we have a thread left. We're gonna do snatching the jawline, the cheek pop, and then we're gonna do some reverse. So if you can see, these are our insertion points to do the reverse thread. And then we're gonna do some collagen threads here to smooth out the 11 lines. And it's going to be beautiful. So we just numbed those areas. We came up with our insertion points. And we're gonna start the main part of the numbing, which is under the skin. So, welcome back. We're gonna do a combination of twist threads, some smooth threads. These are the long ones I use for the lower face. And of course, my workhorse for the reverse threads is the axle thread. I am the KOL for axle threads from Korea. The beautiful thing for this is not engaged, so I will show you how easy these threads go. Slide these very nice and gentle under the skin. I like it a lot for the reverse lift, so you can start with that here. I know where I numb, so I exactly put it right through that channel that we numbed. And you can see how easy they go. We engage them, the thread stays. And just like that, okay? Did you feel anything? Very good. So these slide very nice and easy. Excellent. So that was one. And then we're gonna do a number of these. So I'm gonna push right through the fascia. We put it right on the fat pad. So this is superficial fat pad that we are engaging and basically moving. So that's what we do. We move the superficial fat pads if we do it right. That's our goal with threads, okay? So you can again see how easy this is tolerated and how quick these can be implemented. And that's going to be the third thread right there, okay? Now we leave this in place and we're going to build our jawline here, okay? So for that, I usually go to my pink, which is the 18 gauge, which is the biggest thread size. And again, usually we kind of build right through the tissue here. You gotta go nice and deep. And we have a lot of tissue here to work with, so. And you may feel this just a little tiny bit more. Why? Because it's a bigger thread. And that's where we are. And we implement and get the thread out right there. Okay, so the cannula is out, the thread stays, and the thread is nice and firm here, pulling the jawline. Very good. Okay, you okay, dear? All right, gonna build the lower part of the jawline. So for that one, I use again viola thread, which is not engaged. So basically combining all these different types. So again, this is a good size for the lower, because you need bigger threads to lift this tissue here, especially in certain anatomies. And then we have to engage this thread, so that's how we do it. It's a very, very friendly and easygoing thread, just like that, okay? So right there, we put 5 threads in less than 5 minutes. So once you know and the patient is comfortable and you've done more than 4,000 cases, this goes pretty easy. Well, for this upper part, I usually use my 19 gauge again. So I go back to the one smaller of size. A 19 gauge is smaller than 18 gauge. So as the numbers get bigger, they get smaller caliber. So this we put right through the marionette line. I want to lift that area, and I'll show you exactly how we're going to end it. One key for providers is not to go through that area, just end the tip of the thread right at the line, right there. Because if you go there, it's a superficial area, the tip of the thread may kind of poke through and be visible. So that's our 6th thread we just put. And now we got a lift. Look at that. The whole jawline is visible here. Okay. So we'll leave that alone. And I'm gonna do my classic right there, which is from here down. and I'm gonna finish this one first. So what we do for this guy is we can do an 18 gauge in her, but because we're doing so many threads, I think 19 gauge is just gonna be enough. So these are classic vectors, which we call it a cheek pop thread. So this goes right through and we end right there. Just like that, okay? And then we put another one, a little bit different angle to lift that smiley line, aka nasolabial fold, which is right there. And you can see again, if you can move around a little bit, put some passion and love into this, would be great, as we talked. There we go, show some angles. And that's our beautiful. And you can see how beautiful this lifts this area, and it's just gonna have a more prominent cheek because the skin is pulled over the cheekbone. She has very nice cheekbones here, so they will be more visible. Okay, so now what we do is we're going to finish with this. So threads, 3 threads, 7, 5, 6, 7, 8. Now we're going to do more, so we're going to probably finish with 12 threads on this side. So we start engaging these to the anchor basically. So as you can see, I don't tie them. I used to tie them before, but we basically just anchor them like that to the skin. And I have my autoclave scissor here, which I'm gonna go like that a little bit. Engage this. This could be a little tiny spicy for the patient. Most of my patients tolerate. So that's how you end. You have a little bunching right there, and you basically go and engage this area and put a little pressure, like at the cheek popping in and showing beautifully. And we're gonna finish this area. So we've already done this. Let's couple threads right there for the reverse lift. We're gonna double these. I like to double them because I anchor them to the skin and they're just stronger. I know a lot of colleagues just use one in these areas. I use 2 for each insertion. So that's 1 right there. In her, I think it's going to be very important to use more threads than less because we've done it before. I know what works for her. So these are again the viola threads we use, and this is a 19 gauge. Sometimes we like to change our angle just a little bit so we kind of pull in different directions up. And that's another one right there. And guess what? We have only one more here, and we're going to engage everything. And I'm going to do a thread count for you guys. And then probably end up with 12 or 13, we'll figure out. And this one goes right there. Okay. Different angle. And gets the cheek lifted in a reverse mode, okay? So that's short. Last thread here, so 3, 5, 7, 9 plus 2, 11 threads. So it's going to be a total of 22 on both sides. And we're going to finish by engaging these and then showing you the difference on both sides. You okay, my dear?
Mm-hmm.
Good. We're almost done with this side. We're going to do a nice matrix thread here. So again, we anchor these nice and gentle, and you will just see right away what kind of nice lift we get with these guys. So again, anchor these. I saw, full disclosure, saw Dr. Emmer do it like this, and I really liked it because I used to tie him before, but if you just do this engagement here and you don't have that little nodule or chance of nodule formation with these, and you just leave it like that. You don't have this little bunching, it's all good. You just leave it like that. What you can do is pull the threads through here because she's got tons of threads going through the scalp here. So that will create scaffold right here, and she'll have a lot of collagen, which will lift eventually. That's the longer term effect of thread. But this little bunching, it's all good. We're gonna leave it like that, okay? That's intentional. And we tell patients, do not worry, that will settle in a couple of days, okay? Now she knows already because she's done it before. So here we're gonna finish with engaging these guys. And I have bigger threads here, so I kind of engage them 2 by 2. I don't want to kind of anchor them all together, but just pair them up and anchor them and make sure this is nice and tight, because the jawline is always harder to lift. And basically create that little thing here, and that's 3 threads, and look at the jawline. Now we're gonna just gently manipulate this just like that, and that's fine. That's a little bunching. We want that, okay? Because we want to reposition the tissue, and it's important for our patient to understand. So we get, after a few days, when this settle down, the whole tissue will be repositioned because the threads are already engaged into the tissue, okay? So now you can do a before, after, or well, this side is not done, and we're gonna get to the left side in a minute, but you can see the difference already. She's got cheek, she's got jawline, much more definition. Again, she knows how threads work, so take a look, dear. Open your eyes. You can see the difference already.
Wow,
everything lifted, cheek, everything. You got the V shape back, okay?
Yeah.
Beautiful. Good. And that's it. Okay, so now we're all done. We put 22 threads. We did the jawline, the cheek, and then the reverse threads, and you can see she's got more magic to the cheeks here. She's got more V shape and more defined jawline, and of course these are the little dimplings that are skin bunching, and that's intentional to keep the tissue up, okay? And that's it. Now we're gonna do some smooth threads, specifically for her. These areas we're gonna fill with smooth or twist threads. So these are Sculptra threads. It's white. It kind of boosts more collagen than your regular blue PDO thread. So I've already numbed the insertion point here. So chin up right there, good. And these are pretty easy going. So literally, so deep right there and out. And we're gonna fill that area all the way down, and that's it. Okay, I'm gonna leave it there for a few minutes. Now, Sculptra threads in general are more expensive than your regular threads, so but they boost collagen much more also. We just do them in certain areas and we don't overdo them. Deep breath, my dear, and out. Okay, so we gotta go nice and superficial. They can cause a little bruising or bleeding, so we keep it gentle and always apply ice after. Deep breath again, out. The insertion point is numb, so they're pretty doable right there. Okay, so one more here. Sculptra threads for 11 lines. Deep breath, out. Good, beautiful. That's it. Excellent. So that's how we do it. So we did 6 Sculptra threads here, and as I told you, this is easy come, easy go. So what we do is just spin a tiny bit here, hold it, and pull out. Okay, thread stays, needle comes out. Okay. Always keep the pressure. This forehead is very vascular, so as gentle as we go, we still have to make sure there's no bleeding, and that looks perfect. There's minimal swelling. So right after, we also apply ice. Again, 6 of these here, twist them and get them out. All the threads are in, needles are out. Just keep the pressure. That's it. Cool.